Hello, this is Dr. Grande. Today's question is, what causes the anger component of borderline personality disorder? If you find this video to be interesting or helpful, please like it and subscribe to my channel. That way you won't miss anything new. Now, we talk about borderline personality disorder. It's first important to recognize that there are 9 symptom criteria and that 5 criteria have to be met for a diagnosis of the disorder. Now, sometimes when we look at causation of disorders like borderline personality disorder, we're interested in what causes the disorder in general. But sometimes it's more helpful to look at a specific symptom of the disorder, even though that symptom isn't always present in every manifestation of the disorder. Now, when we talk about anger in borderline personality disorder, we're talking about one specific symptom criterion. So first I'll go through all of the symptom criteria and then into more detail about the anger. So again, there are 9 symptom criteria with borderline personality disorder in the Diagnostic and Statistical Manual. The first is frantic efforts to avoid abandonment. Then we have unstable and intense relationships, identity disturbance, impulsivity, suicidal behavior, affective instability, a chronic feeling of emptiness, inappropriate, intense anger or difficulty controlling anger, and this is the anger criterion I was talking about earlier, and paranoid ideation. Now taking a look just specifically at that anger criterion in borderline personality disorder. Now, there was a study published in 2012 by Distel and colleagues that looked at this question, the question of what leads to the anger in borderline personality disorder. So first, it's important to understand that trait anger is different than state anger, and both of those are different than what we see in borderline personality disorder. Both of those are different than the symptom criterion. Of course, there's a lot of overlap, particularly between trait anger and that symptom of borderline personality disorder, but they're not the same thing. Trait anger can cause difficulties for individuals even when they don't meet the full criteria for borderline personality disorder. And that symptom of borderline personality disorder, the inappropriate intense anger, that can be present even if somebody doesn't have borderline personality disorder. And there are a lot of different consequences to anger, which I'll talk about in a moment. But first, understand the difference between trait and state. State anger is episodic and fairly normal. Most everybody will have state anger from time to time in their lives. Trait anger is an aspect of personality, and that's why we tend to think of trait anger as much more related to this anger symptom criterion in borderline personality disorder. Now, this anger symptom criterion is actually the most prevalent symptom criterion with borderline personality disorder. It's more prevalent than the other 8 symptom criteria. It's the most prevalent in clinical and non-clinical samples, and it's also the most prevalent in first-degree relatives of individuals with borderline personality disorder. So there's this idea that this one symptom criterion is a cornerstone with borderline personality disorder. To understand how this symptom criterion is met, what causes it, helps us to understand borderline personality disorder in general. Another interesting point with this anger criterion is when we look at all the symptom criteria for borderline personality disorder, we know there's a general tendency for these symptoms to remit over time. They don't remit in every instance, but oftentimes they do to some degree, and some remit faster than others. The anger criterion is the slowest to remit over time. So it's the most stubborn in essence. It tends to hang on the longest of all the symptom criteria. This anger criterion is also associated with a number of negative outcomes. And some of these are negative outcomes related to the other symptom criteria in borderline personality disorder, and some aren't. For example, we see with the anger criterion endorsed, we see decreased functioning in work and social settings. We see increased incidence of comorbidity with substance use disorders. We also see increased suicidal behavior, increased impulsivity, and increased paranoid ideation. Those 3, of course, symptoms for borderline personality disorder. We also see that anger is related to rejection sensitivity and increased conflict. And with individuals who meet the symptom criterion, there's a tendency to ruminate over past real or perceived transgressions. We also know that this symptom criterion is related to aggression. And of course, aggression is a significant problem with borderline personality disorder because the consequences are so severe. Research indicates that 58% of individuals with borderline personality disorder have been occasionally or often involved in physical fights. 73% have engaged in aggressive behaviors within the past year, and 25% have used a weapon against another person at some point in their lives. So aggression is a serious issue, and it has a strong link to this anger criterion in borderline personality disorder. So what causes trait anger or someone to meet this anger criterion in borderline personality disorder? Well, it's a mix of a genetic component and an environmental component. So we call this heritability and environmentability. And the study that I referenced earlier, Distal and colleagues from 2012, indicated that 54% of the variance could be explained through genetics. And of course that leaves 46% explained through the environment. There are a number of theories as to what environmental variables lead to this anger. Causation is sometimes referred to as etiology. So in terms of the etiology from the environment for this anger criterion, we see an invalidating environment when somebody's a child. So this is an environment where someone's thoughts, feelings, and behaviors are labeled as inappropriate, even if they're not inappropriate. We also see with the environmental components that are etiological, it's possible that trauma, neglect, and abuse have an etiological component to this anger as well. Now we know that these contributions from genetics and from the environment at a level of 54% and 46%, as was the case in this particular study, these figures are fairly close to what we see with borderline personality disorder in general. We usually think of 50% of the etiology for borderline personality disorder as based in genetics and 50% with the environment. So this anger component lines up fairly well with the personality disorder in general. Also, these results line up fairly well with what we see with personality disorders in general. We usually think of personality disorders as somewhere between 40 and 60% based on genetics in terms of the etiology. These findings make a lot of sense based on what we know about this anger criterion with borderline personality disorder. We know that this particular criterion is linked to a number of other symptom criteria. It tends to be connected with a lot of the painful consequences of borderline personality disorder. So it makes sense that the genetic versus environmental etiological contribution is similar to what we see for the personality disorder and for personality disorders in general. I hope you found this description of what causes the anger component of borderline personality disorder to be interesting. Thanks for watching.